And, of course, today being whipped cream day, which is very exciting
absolutely,
indeed.
yes.
Talking of not being very healthy, there are two big health stories this morning. Let me just show, this is the front page of the Sunday Times. Patients must get choice of 5 hospitals. So Wes Streeting trying to take control of the NHS. I mean, look, we're spending 200 billion quid on the NHS. The outcomes are pretty terrible when you compare them with our European neighbours. So something has to give. Now, what he's saying here is doctors must offer patients a choice of 5 hospitals when they refer them from treatment. This is according to Wes Streeting. He's vowed to end the like it or lump it culture. Now, tomorrow is this big speech by Starmer where they're going to set out the government plan to reduce the NHS waiting list. We know on the primary waiting list, 7.5 million people. And we spoke about this yesterday. There's going to be this NHS app. You're going to be able to request 5 different hospitals. That's not the issue here, actually. I just kind of think this is window dressing without actually sorting out a much bigger problem.
I agree with you on this. I mean, I think, you know, do I really care about choosing between 5 hospitals? I actually think the app, and my understanding is we're going to use the existing app, the one that came about during COVID. So the use of the app, I think, is great. I can use an app now to book a GP appointment.
Which is good.
Which is fantastic, yeah, because that used to be really difficult. But no, this certainly isn't top of my list, wanting a choice of hospitals. I think what's top of my list is, you know, modernisation. You know, I was listening to a GP yesterday talking about how every time they refer you, they have to write a letter to...
That's right.
You know, it's just, it's very 1947 or whenever the NHS started, isn't it?
48.
You know? 48, sorry.
Yeah, I mean, so it is complicated. And also, if you say to the patient, which hospital would you like to go to, how do they know which one to go to? What Streeting is saying is that there's a trade-off between going locally, which I understand, and then going to a centre of excellence. He had cancer. He chose to go to a centre of excellence, but he's in a position where he's informed, where he can talk to people and say, well, where is the best hospital to do this? Now, in my own family history, I had a big discussion with my father over whether I wanted him in a centre of excellence, he wanted to go to a local hospital. I think he made the wrong decision. He went to a local hospital. I think I was right because I think you need to be in a centre of excellence. The question I have here is how on earth do people know what the best hospital is?
Well, interestingly, they're kind of mirroring what happens in private healthcare, because if somebody has private healthcare insurance, they then choose which hospital they want to go to.
They do.
And that actually requires quite a lot of research, and it's quite difficult to make an informed decision. I mean, you go online and look at different consultants, and I'm not sure how many people are going to have the resources to do that, really.
I would agree. He says patients feel powerless. They lack control. It's still stuck in the age of one-size-fits-all, top-down, like it or lump it. Look, I think there are ways that we can actually make the system far more streamlined. I really welcome the idea that GPs can actually refer patients directly for tests without actually going through the consultant. All of that makes sense, actually.
I think there's something about quicker access to consultants. I feel a bit infantilised sometimes by the NHS, that I have to kind of, you know, beg, steal or borrow from my GP and ask for access to hospitals and consultants. And I wish I had easier access myself to
refer yourself directly?
Somehow, I'm not quite sure how it would work, and I appreciate that, you know, you need some clinical understanding, etc. But if you've got an ongoing issue that you're, you know, often if you have an ongoing issue, you become quite expert on it. And
well, so one of the other things is we have this kind of bizarre system where the GP is the gatekeeper. So you have to go to the GP. Now, if you've got a rash, let's say, it would be, and certainly what they do in America is you would see a dermatologist.
Yes.
You wouldn't go to a GP.
That's the kind of thing that I mean, yes. Yeah.
Well, there's another story as well this morning, if you are just waking up. The Sunday Telegraph, Streeting rids the NHS of pointless checkups. So tomorrow they're going to unveil the app. He's now saying you've got the choice of 5 hospitals, but he's also vowing to scrap more than 1 million pointless NHS hospital appointments as he seeks to cut waiting lists. He says that these are a waste of time. Now, I'm a clinician, or I'm a doctor by training. I read this and I thought, how does Wes Streeting know what is an appropriate follow-up after elective surgery, because actually when you've had an elective procedure, I do think it's really important that you have a follow-up. Now, there are ways of doing those follow-ups. It could be that you can do it virtually, just doing a quick Zoom call, or you have to see someone. But I'm not sure. He talks about telemetry, the role of AI, all of that kind of stuff. This is actually, there's something that people have been trying to do for about 10 years. I'm not sure we're quite there yet.
Well, I mean, this is the whole issue of who should manage clinical services. Should it be clinicians or managers, or indeed politicians?
Clinicians.
Yes, and of
is
course,
the answer.
Clinicians is the answer, yes.
Well, I don't know, and obviously they're trying desperately to use this as political capital to move the agenda on. How successful do you think that will be?
Well, we have to hear what they've got to say tomorrow, of course. I think the public is really waiting for change on the NHS because, you know, lots of us come into contact with the NHS on a day-to-day basis, and people are really fed up of the service that they're getting.
So also, when you look electorally, what's important? So immigration, the economy, health service, number 3 of those. I think what they have to do is to persuade people they are the right party to do that. One thing I would just caveat this with, elderly people being driven onto an app. Many older people, I'm not saying all of them, but many older people don't like that. They like to phone someone. They want to talk to someone. They want an appointment they can write in a paper diary. They don't want it done on an app, and I'm not sure the government really gets that.
I am really torn on this because I am desperate for things to be digitised. You know, I don't
but you're a young man.
Well, this is it. And you know, I've got a sister who's quite a lot older than me who really struggles with anything digital. In fact, I have to pay for stuff for her over the phone and stuff like that because she's anxious about giving out her details. And so I really understand what you're saying here. How do we, I don't know how we square this circle. How do we digitise and still retain access for people who don't feel they can cope with digitisation?
I think you have to offer both, actually.
Yeah.
So you move towards a technological revolution, but at the same time, it's really important that... And the elderly people are the ones that are most likely to use those healthcare services.
It's true. I mean, I guess it's like disability. If somebody is disabled and needs, you know, some kind of access for them to be able to access services, some sort of adaptation, then we make that. And I guess that's what we have to do for people who are non-digital. I do think we should try harder to get older people. Of course, not all older people struggle with digital stuff. I think we need to try harder as a society to bring them on board.
I do too. Just very quickly, on the Spanish theme this morning, we're talking about good morning to Adam and Steve, watching in Marira. Fab show as always. Very good morning to you boys. Also, this one, Peter is in Mijas in southern... We're very big in Spain. In southern Spain, where the Epiphany Parade took place last night. It was, as usual, very colourful. It was very friendly. There were 3 polar bears representing the 3 kings. Wow. He goes on to say, and this is the question I'm asking this morning, who or what do you think is the biggest threat to Keir Starmer? The number 0344 499 1000. He says the biggest threat to Starmer is reform, and he knows it.